Welcome back to Metta Health Talk. Today we are talking about two bean-shaped organs in your lower back that are responsible for keeping you alive every single second. The kidneys. Here is the scary truth about kidney disease. It is silent. The kidneys have very few pain receptors. You can lose 40%, 60%, even 90% of your kidney function and feel absolutely nothing. By the time you feel back pain, nausea, or metallic taste in your mouth, it is often too late. You are already at end-stage renal disease, ESRD, looking at dialysis or a transplant. Globally, 1 in 10 people have chronic kidney disease, CKD, and 9 out of 10 of them don't know it. This is a silent epidemic. But there are warning signs if you know where to look. There are numbers on your blood test that scream help. Years before the crash. Today, we are going to learn how to read those numbers, specifically eGFR, creatinine, and albumin. We will discuss the dangers of healthy foods like bananas and brown rice for kidney patients, and we will learn how to stop the silent leak before it destroys your filter. To understand the disease, imagine making coffee. You have a paper filter. You pour water and coffee grounds into it. The filter. This is your glomerulus. You have about 1 million of these microscopic filters in each kidney. The coffee grounds. These are your red blood cells and proteins albumin. They are large and valuable. They are supposed to stay inside the filter in the blood. The liquid coffee. This is the wastewater and toxins urine. It is supposed to go through the filter and out into the cup bladder. Now, let's zoom in deeper. Lining this filter are special cells called podocytes. These cells have feet that interlock like a zipper. They form the final barrier. In a healthy kidney, the zipper is tight. Only water gets out. In a damaged kidney from high pressure or sugar, the podocytes get damaged and their feet heated. The zipper breaks open. The coffee grounds, protein and blood start leaking into the cup. Once a podocyte is dead, it usually doesn't grow back. This is why kidney damage is often permanent. Now look at your blood test. You will see two key numbers and maybe a third one you need to ask for. 1. Creatinine. Creatinine is a waste product from your muscles. Healthy kidneys filter this out 24/7. If your creatinine is high, such as above 1.2 mg per deciliter for women, 1.4 for men, it means the trash is piling up. 2. eGFR, estimated glomerular filtration rate. This is a circulated number based on your age and creatinine. Think of eGFR as your kidney function percentage. Above 90, normal, grade 1. 60 to 89, mild damage, grade 2. 30 to 59, moderate damage, grade 3. This is crucial. Below 15, kidney failure. 3. Cystatin C. Here is the pro tip. Creatinine can be misleading. If you are a bodybuilder with huge muscles, your creatinine will be naturally high, even if your kidneys are fine. If you are an elderly woman with no muscle, your creatinine will be low, masking kidney failure. If your eGFR seems borderline, ask your doctor for a cystatin C test. It is not affected by muscle mass and gives a much truer picture of kidney function. Before the eGFR drops, there is an earlier warning sign. Remember the coffee filter? The holes get big before the filter totally collapses. When the holes get big, albumin protein leaks into the urine. The symptom. Look at your toilet bowl. Is your urine foamy? Does it look like beer foam or soap suds that don't flush away easily? There is protein reacting with the water. If you see foamy urine, ask your doctor for a specific test. UACR, Urine Albumin-to-Creatinine Ratio. This test measures exactly how much protein is leaking. Normal, less than 30 mg per gram. Microalbuminuria 30 to 300 mg per gram, the warning zone. Macroalbuminuria over 300 mg per gram, severe leakage. Catching the disease here in the microalbuminuria stage is your best chance to reverse the damage. If you lower your blood pressure now, the filter holes can shrink back down. If you wait until you have macroalbuminuria, the damage is often scarring, which is irreversible. What punches holes in the filter? 3 main culprits. 1. Diabetes type 2. High blood sugar acts like shard of glass. Glucose molecules stick to the proteins in the filter glycation, making them stiff and brittle until they crack. 40% of kidney failure is caused by diabetes. 2. Hypertension. Imagine hooking a fire hose up to the coffee filter. The pressure is too high. The delicate blood vessels simply burst. 3. NSAIDs, painkillers. This includes ibuprofen, naproxen, and high-dose aspirin. The kidney regulates its own blood flow. The entry artery needs to stay open. NSAID work by blocking prostaglandins, which act as the doorstep to keep the artery open. When you take ibuprofen, you kick the doorstep away, and the artery clamps shut. You choke the kidney's blood supply. Taking painkillers while dehydrated is a recipe for acute kidney injury. If you have CKD, stick to Tylenol, acetaminophen. If you are healthy, you can eat anything. But if you have stage 3 or 4 CKD, healthy foods can become poisons. We need to talk about electrolytes. 1. Potassium. Normally, kidneys flush out excess potassium. If they are damaged, potassium builds up in the blood. This is dangerous because high potassium can stop your heart instantly. Foods high in potassium include bananas, avocados, potatoes, and tomatoes. If your doctor says your potassium is high, you must limit these healthy foods. 2. Phosphorus. This is the bone eater. Damaged kidneys cannot excrete phosphorus. High phosphorus pulls calcium out of your bones, making them brittle. It also causes severe itching and calcification of your arteries, turning your blood vessels into stone. Phosphorus is hidden in dark soda, cola, processed meats, and dairy. For kidney patients, avoiding processed food is not just about weight loss. It is about saving your bones and arteries. So what is the renal diet? 1. Sodium. Salt is public enemy number 1. Salt holds water. Extra water raises blood pressure. High pressure breaks the filter. You must limit sodium to 2000 mg per day. 2. Protein management. This is controversial but vital. Protein creates nitrogen waste. The kidney has to work hard to filter this waste. If you have CKD, eating huge steaks is like revving a damaged engine. It causes hyperfiltration. We recommend a moderate protein intake, 0.6 to 0.8 grams per kilogram of body weight. However, plant-based protein is superior for kidneys. A study showed that plant protein, beans, tofu, places less stress on the kidneys than animal protein because it induces less hyperfiltration and creates less acid. So try to swap 50% of your meat for plant-based options. We must also talk about metabolic acidosis. Your kidneys are responsible for balancing the acid in your blood. When they fail, your blood becomes slightly acidic. This forces your body to break down muscle and bone to neutralize the acid. A simple hack: sodium bicarbonate, baking soda. Clinical trials have shown that giving small doses of baking soda to CKD patients slow the progression of the disease and protects muscle mass. Consult your doctor first, but correcting acidity is a powerful tool. Also, kidney stones. Most stones are calcium oxalate. The myth is to stop eating calcium. This is wrong. You need calcium to bind oxalate in the gut, so you poop it out. If you don't eat calcium, the oxalate goes to the kidneys and forms stones. So eat calcium-rich foods with your meals, but drink plenty of water with lemon citrate to prevent crystals from forming. Finally, hydration and medication. We are told drink 8 glasses a day for healthy people. Yes, clear urine prevents stones, but for late-stage CKD forfeit, kidneys cannot remove water. Drinking 4 liters will drown you. Fluid in lungs, fluid in legs. Healthy stage 1 to 2, drink to thirst. Stage 3 to 5, restrict fluid as per doctor. Protective meds, while NSAIDs, heart kidneys. Some meds save them. ACE inhibitors, AC inhibitors, lisinopril and ARBs, losartan. These blood pressure meds specifically lower the pressure inside the glomerulus filter. They reduced proteinuria. SGLT2 inhibitors. These diabetes drugs are now drugs for kidneys, even in non-diabetics. They reduce the workload of the nephron. Don't be afraid of these meds. They are the shield for your filter. To conclude, kidney disease is not a death sentence if caught early, but you cannot feel it. You must measure it. Next time you see your doctor, ask for 1. eGFR, your percentage. 2. UACR urine test, the silent leak. 3. Cystatin C, if you want accuracy. Protect the filter, control the pressure, watch the electrolytes. Thank you for joining this masterclass on Metta Health Talk. If you want to keep your engine running smoothly for decades, please subscribe and share this video. Your kidneys will thank you.